Okay, we are ready to start. Thank you all for being here. Welcome from the middle of Estonia. Welcome everyone. My name is Lauri Beekmann. I'm the Executive Director of the Nordic Alcohol and Drug Policy Network, NordAN. And I thank you all for being here and showing your interest on this topic, which is so very understandable, of course. Most of you either work with preventing cancer or with alcohol policy, where alcohol and cancer link is playing a very important role. I want to start with thanking Eurocare, who made possible for us to use their Zoom account. So thank you, Marianne. Thank you also, Nils, who is here co-hosting with me and who takes care of the Q&A part. So if you have any questions during any of the presentations, write it up and Nils will take care of it. If you have time during the or right after each presentation, Nils will raise these questions then, but if time runs out, we will come back to it in the end of the whole webinar. And of course, I have to thank SAF, Stiftelsen Ansvar för Framtiden, Foundation, for their financial support. Now, before we start with the main part of our presentations, a couple of thoughts that I want to share with you. The whole society, as all of us, I believe, have a very close and personal relationship with this disease. In a way, I think we can say we are all experts in some ways. I don't think there is a family who hasn't been touched by cancer in one way or the other. And yes, this is also true with myself. Cancer took my mother 18 years ago and my sister only 5 years ago, both way too young. And that personal experience that so many of us have means that we are not indifferent regarding cancer prevention. It's not just a distant theoretical problem, and I believe this should be the positive aspect in this. If we would know the cure, if we would know how we could avoid it and how we could prevent it for our families, I do believe people would embrace it. So we started this project on alcohol and cancer, trying to understand where we are, what is being done by different organizations and institutions, our countries in our region, and how we could do more. One of the first findings and problems that we have found is the lack of awareness in our countries. These numbers, and I believe we will hear more about it from our panelists, show that the situation, according to national surveys and studies, is even worse actually than we might have believed based on some earlier international estimates that are available. On average, 20 to 30, at best 40% are aware that alcohol causes cancer. And that is clearly a problem. So why doesn't this information that is so well known by the scientific communities, why it hasn't reached most of the people, regardless of what is being done by so many organizations? So what could we do differently? And that is one of the main questions that we also want to raise with this webinar. And it's not only about the low levels of awareness, but also about the quality of that awareness. What does it mean that alcohol causes cancer? People are kind of overburdened with all sorts of dangers and threats about that information that is flowing in. And also about various conflicting information. Yes, they might know it, the fact, but does it affect their behavior in any actual way? Just this Monday, I uploaded a post to our alcohol awareness blog about a recent study in Canada that asked, does drinking within Canada's low-risk guidelines prevent harm? And by the way, this blog, Alcohol Awareness, has 130 different materials, campaigns, videos, infographics, and so on in this alcohol and cancer category, and it's freely available resource. But back to this University of Victoria study, which found that more than 50% of alcohol-caused cancer deaths are experienced by those drinking within weekly limits. So we are talking about low-risk guidelines here. This is another piece of information that our countries are trying to get through to people, to understand the alcohol units and risks that are associated with different levels of drinking. And obviously, if people would recognize these guidelines and they would actually lower their drinking accordingly, that would clearly benefit many. But still, as the study found, people who drink within these guidelines, more than half of alcohol-caused cancer deaths are coming from that group. Let me give another example, raise another sort of problem. Earlier this month, Australia's largest ever investigation of the impact of alcohol and cancer risk found that one drink a day raises risk of alcohol-linked cancers by 10%. Maybe you heard the headline. The study also gave estimates on what is the total cancer prevalence caused by alcohol in Australia. And that number was very different compared to the one that the WHO Cancer Country Profiles 2020 gave for Australia. I approached the lead author of that Australian study and asked his opinion about this. What could be the reason? First of all, he couldn't explain it. He couldn't understand why these numbers are so different, nor from where WHO got its figures. But perhaps even more alarming was that this Australia's leading scientist on alcohol and cancer hadn't actually heard about WHO's cancer country profiles and the fact that WHO, World Health Organization, gives estimates to national situations. So, in conclusion, I dare to say that we have a problem with data. And I think it's a global problem. Perhaps even that global reach might be in the center of that problem. Our interest to compare countries with other countries sometimes causes issues. Our interest to publish one comparable list after another. But of course, we need data. We need good data. One of the aims of our project is to publish a new website, gathering all available information, first from our own region, from Nordic and Baltic countries. But that initial plan is now growing into something even much better and bigger. Together with Eurocare and European Cancer Leagues, we are soon relaunching the alcoholandcancer.eu website, which was started by Eurocare, I think almost 10 years ago now, but has been in a sort of a coma state for some time. At the moment, this is a work in progress, but soon enough the website will be relaunched. And of course, we are also very happy for the close cooperation with different national cancer societies in our region, who are doing excellent work. The work that they are doing is noteworthy, and we hear much more from them during this webinar now as well. So we have 5 speakers today, and we start now with Carina from Norwegian Cancer Society. So Carina, turn your microphone and video on. Your video is already there. and share your screen for us. So to say, the floor is yours.
Okay, dear colleagues and friends, good afternoon, and thank you for the invitation, Lauri, to talk about what we as a cancer society can do to increase awareness of the link between alcohol and cancer. I hope all of you are doing fine in this very challenging year. So, what role can and should cancer societies take? I work at the Norwegian Cancer Society as a special advisor in the preventive department, handling the NCD portfolio. As other cancer societies, we work with health promotion, fundraising, and advocate for cancer patients and their relatives in all possible ways. We fund a huge part of Norwegian cancer research, $22 million this year. We are also part of the Norwegian NCD Alliance, where we have a lot of common interests when it comes to the NCD agenda, especially targeting the risk factors. The last 6 months have been challenging for us, as for so many other organizations. We had to quickly find new ways to collaborate, provide for our patients, raise money, and do digital advocacy work. We still work mostly from home, and it's kind of unbelievable how quick we've been used to all these different digital platforms. In this short presentation, I'll give you some Norwegian data and discuss where we can contribute. I'm sure you know that Norway do quite well when it comes to the statistics. We drink least among the Nordic countries, and 80% of what we drink is beer and wine, most of it from the state monopoly. Surveys during the corona months show that the consumption hasn't changed much. Even if we have shopped more from the monopoly and local stores, of course, due to the halt in traveling and restrictions in cross-border shopping and restrictions in drinking and dining out, we haven't been drinking more. The Norwegian data of the burden of alcohol as a risk factor come from our National Cancer Registry. Those figures we have tell that alcohol attributable cancers counts for approximately 5% of total cases in Norway. You are also aware of that Norway for many years has had strict alcohol policies in place. The only two things we couldn't check out in the latest global status report was a national strategy and a labeling scheme in place. We are now working on both these issues. Norway usually get on top on international statistics, and we will most probably also reach the NCD target on alcohol in 2025. Still, there's a lot to do nationally. NCDs count for 87% of the disease burden and 2 of 3 deaths. In 2017, cancer for the first time passed cardiovascular diseases as the leading cause of deaths in Norway. The social inequalities in health are also troublesome. The advances in health haven't been fairly distributed. And as we all know, especially in this webinar, when it comes to public health, you can never let the guard down. We in this Zoom meeting know very well about the burden of alcohol. Most of us also know that alcohol is strongly linked to and can cause several types of cancer. This we have known since 1987. For cancer prevention, it's best not to drink alcohol, says the guidelines from World Cancer Research Fund. And there is no safe lower limit. You mentioned it in the beginning, Lauri. Many will argue that this link hasn't gotten the attention it deserves. Some advocates talk about alcohol as the blind spot of global health. It is also very seldom an issue of public debate in Norway. But maybe this is about to change now. The ongoing process in WHO towards an action plan in 2022, the upcoming EU cancer plan, the cancer beating plan, promising to include alcohol, and a lot of advocacy work being done from civil society to make sure we get the necessary policies. This gives some hope. At the Global Alcohol Policy Congress in Dublin in March, just before the world closed down to COVID, it was said that carcinogenicity of alcohol paves ways to stronger alcohol control policies. Many will argue it's about time the cancer community get on board. The latest global burden of disease study published in Lancet 2 weeks ago showed that alcohol is among risk factors that are worsening worldwide and still takes too many early lives between 15 and 49 years. This doesn't come as a surprise to this audience either. This review from 2018 across the world revealed a huge lack of awareness. It is in company with many other national and international studies that show the same. You also said it, Lauri, we all know this. Even if Norway is ahead compared to many countries regarding alcohol policies and understanding of alcohol-related harm, Norwegians aren't doing any better than others when it comes to understanding the link. Data from national surveys has shown that 7 out of 10 Norwegian women do not know that there is a connection between alcohol and cancer. The American Society of Clinical Oncology published an important statement 2 years ago on the need for the cancer community to support policy efforts and to promote public education on this issue. But why is it so challenging to bring the message out there? Different from smoking, for example, alcohol is not framed or perceived as only unhealthy. Drinking is also an enjoyed and desirable behavior that has big place in many societies. It's cultural. I also think that most people believe they have a not harming consumption. Very few know about the no safe lower limit. The long-term risk compared to the immediate pleasure is easy to dismiss. It's also valid for a lot of other things. We know this by ourselves. And the myth about heart health from a glass of red wine is still very much alive. And as so much else in the public health sphere, people don't like to be told what to do. When it comes to serious diagnosis as cancer, we also need to be very sensitive with how we frame the message. We need to change the language and move from personal to public health. This is a population level problem that requires population level messaging and policy solutions. We're not going after your glass of wine, and we would never say that you get your cancer because you had too much to drink. We are aiming for the evidence-based policies at the structural level. If all of us drink just 1 glass less, we will be able to see it in future cancer statistics. We know that more restrictive alcohol control policies are related to lower levels of consumption. This is what WHO's Best Buys is all about. But little has been known about the relationship between strict policies and rates of cancers. A study from United States published last year could show that more restrictive state alcohol policies actually were associated with lower cancer mortality later. Research also showed that support for alcohol policies is greater among those who are aware of risk. So increasing awareness and knowledge is important for many reasons. People have a right to know that alcohol causes cancer, so they can decide for themselves whether drinking is worth the risk. So what is the Norwegian Cancer Society doing? Apart from providing information on our website and a few leaflets about alcohol as a risk factor, most of our work is about advocating for strict policies and structural measures. It's about the necessity of keeping the price and taxes high and protesting to any attempts of softening existing policies in Norway. We also ask for getting alcohol out of tax-free or reducing the quotas. Both our Prime and Health Minister are huge proponents of WHO's Best Buys and fiscal tools internationally. We are trying to hold them accountable on these promises also at home. We are, as all other countries, very worried about the marketing in new digital channels and promotion by influencers. Even if it's restricted by law, 25% of Norwegian 16 years old have seen alcohol marketed in their social media feeds. How can we better monitor and legislate around this ever-going problem? Norwegian Cancer Society have for many years proposed that labeling should be mandatory and hope to be the second country after Ireland to have cancer labeling legislated. We know from others' experience that this is going to be an uphill battle, but would love to see Norway being a driving force for this. In 2018, Norwegian Parliament voted on a proposal to introduce health labeling on alcohol. Many parties support this policy in principle. However, this has yet to be implemented, and everyone is talking about what is happening in EU. The proposal in question includes labels regarding pregnancy and drunk driving, so there's still work to be done to include cancer warnings. Next week, we're arranging a webinar together with Actis and Eurocare. It's all about labeling, and we have invited 3 Norwegian politicians from different parties to hear their views on this issue. Okay, well, there it is. Regarding campaigning, the Norwegian Cancer Society collaborated in 2016 with IOGT-NTO, a Norwegian NGO with an alcohol policy agenda, and the Directorate of Health with the theme One Glass Less. In this campaign, we directed our efforts to women in the work life. We have this film, leaflets, we posted in blogs, and we were present at the National Nursing Congress and reached a big audience with this One Glass Less message. This short 1-minute film is still on our website. A new national alcohol strategy is right now being written and planned to be launched next month. We have high expectations, even if the political landscape and the COVID-19 crisis have seemed to challenge public health bigly. There are almost daily articles in the media about what needs to be done to save jobs and stop cross-border shopping. The Conservative Party suggested in their new program that the taxes and excise duties on both alcohol, tobacco and sugar should be decreased for this reason. This is also a big issue for the Progress Party. They even suggested to lower the age limit for buying beer and tobacco. It will be hard political fights during the fall on the national budget for the next year. We are doing what we can on our own and in collaboration with other organizations to make the case for public health in these discussions, through opinions and commentaries in the newspapers and at committee hearings. This is a call for help from Sweden and Denmark. We wish our neighboring countries could harmonize their taxes and prices with ours instead of Norway have to decrease ours. We need your help there. My last slide, just to sum up, this is an ongoing work. COVID-19 has showed around the world that a strong population health is more crucial than ever. As a national cancer society and a trusted source for information and prevention policies, we have a duty and the responsibility to make people aware of the link between alcohol and health risks. We have to support and promote policies already in place and push for new solutions. Any policy that reduces alcohol intake will result in fewer cancers. All of us here today know that there's a lot of great information out there. You mentioned your own website in progress, Lauri, and there you can find a glimpse at 130 different alcohol campaigns and get a lot of inspiration. But it's those unknowing who don't even know that they don't know they are the ones we need to reach. So by this, I thank you all for the attention, and special thanks for Lauri for all the work you do with this project so that we can get together and learn from each other. Now I'm looking forward to hearing from my Nordic colleagues. Thank you so much.
Thank you very much, Carina, and thank you for the work that you are doing. My general comment to everybody today is that the Nordic cancer societies are doing an excellent work, and I'm afraid that in many countries this is not the case when it comes to alcohol and cancer link. At least in some countries, this may have been neglected too much. So thank you very much. Just to remind you again that when you are listening, you can ask questions. There is a Q&A part down in the line there, so ask away, and we can come back to these questions in the end of the webinar. Now we move to Finland, and Dr. Eeva Ollila is from the Cancer Society of Finland. Please unmute your microphone and share your screen.
So good afternoon to everybody. Am I sharing my slides now?
Yes, you are. Please
Very good.
Put it on full screen as well.
Okay, yeah. So first, I would like to thank Carina for the excellent presentation that made my presentation a bit easier, because some things I can pass a bit quicker, and I hope that we nicely complement each other. First of all, just to show that the alcohol consumption in Finland, we have beer as the dominating source. And there is the beer, spirits, wine, long drinks, and ciders in the order of magnitude. As was already discussed, alcohol causes a significant proportion of cancers. However, the data is very inaccurate, just as Lauri brought up. Because when we look at the epidemiological studies, at least in the Nordic countries and the Finnish part, it's very excellent, very careful epidemiological studies, but the data behind the studies is not very good, because it's based on people's own estimates of what they are drinking, and those people who drink most don't answer that kind of surveys. And in some of the surveys, for instance, weekends are excluded. So in fact, when you look at the very careful epidemiological studies, you get very low estimates compared to the ones that WHO, for instance, gets. And it's basically due to the poor data that we have. Carina actually talked about these issues on this slide already, so I think I skip this. Maybe the one point I will still kind of point out is that the risk of cancer correlates with the amount of alcohol a person consumes during his or her lifetime. So that means that even small consumption during a long period of time increases the risk substantially. And when we look at the causes of burden of disease, many of the causes that are listed are actually cancers. In some forms of cancers, like the mouth, throat, and larynx, the role of alcohol is very big, and especially if you smoke, then it's even much bigger. The risk multiplies with smoking and alcohol consumption together. What I wanted to, though, discuss a little bit is that the alcohol causes so many diseases, and from a kind of individual point of view, from the person who's using alcohol, it's perhaps even more important to understand that the devastating effect of health that alcohol has, because a person will not oftentimes will not think about, you know, whether he wants to choose cancer or cardiovascular diseases, or what type of ill health the person wants to choose. So I think that in many cases it's very important to communicate the overall ill health effects, and there one should not be misguided by the statistical category of mortality from alcohol diseases, because alcohol diseases is a very exempt category. A small amount of the alcohol caused ill health is caused by those diseases that in which alcohol is the predominant cause. So, for instance, cancers and cardiovascular diseases in general are not part of that category of alcohol diseases. The burden is immense, as you can see, and Europe is the worst affected continent, and there especially Eastern Europe. So even though this is about alcohol and cancer awareness, I still wanted to, from the kind of alcohol policy point of view, for the society, it's important to, in addition to understand the ill health link, also the overall societal effects of alcohol consumption, because oftentimes, for instance, the business sector may think that it is in its role to advocate for relaxed alcohol policies without understanding that it's only the alcohol and tourist industry, basically restaurants, tourist industry, that benefit from increased alcohol consumption, but the overall effects on the business are devastating because of the decreased productivity, increased early retirement, sick leaves, and accidents. So I'm coming back to that when we talk about I talk a little bit later a bit more about the awareness and awareness raising. So why is alcohol and cancer linked? In addition to the fact that it actually causes a lot of cancers, like Lauri was pointing out in the beginning, that most of the cancer cases come from very actually low consumption. For instance, 60% of women's alcohol-linked cancers are breast cancers, and most of those, because it's such a very common cancer, most will be rather low users, consumptors of alcohol. I think Carina's point about the public health aspect is very, very important, that it's not the individual that we are targeting. We are trying to get the overall consumption down, because that has the biggest public health effects. So that's one point why the alcohol and cancer link is so important, because the effect is so big in cancers. But second of all, I think from the alcohol policy point of view, it is important from the point of view that there's no J-curve, like Carina was also pointing out, because that has been very difficult, even if many people think it's an artifact that a small consumption of alcohol could be, for instance, good for cardiovascular diseases. It has made it more difficult to get the message across that alcohol is harmful for health. So when you bring the alcohol and cancer to the discussion, there's no J-curve, and so there's no safe amount of alcohol, just as Carina was also pointing out. So that's the second why alcohol is important. And then the third aspect that I think why alcohol why cancer in the overall alcohol debate is important, and that is that cancer is something that people take very seriously. It's partly because of the stigma, that that is linked to cancer. But I mean, when people hear that alcohol is carcinogenic, they normally take it seriously. And therefore, for instance, I would be a very strong supporter of labeling, the alcohol labeling as a carcinogenic, because it's, if there could be one label only, I would go for alcohol and cancer, the carcinogenic effect, for many reasons, but for one reason, because of the fact that people do take that seriously. When we then talk about awareness raising, I wanted a little bit stop on thinking about, you know, who do we want to be aware and why? Because I think it's extremely important that we always think about the audience that we are talking to and what we want to achieve. I think in the introduction, Lauri was mainly talking about the public and the individuals, which are extremely important audiences. As the public, we need the public support for policies that we are proposing, but also as a population change, as a behavior change of the overall population. For the individuals, of course, it's a behavior change for those in risk and those in families with risks. But we also have other audiences than these two. And one of them, obviously, I mean, I'm not telling you any news, but I mean, the politicians and civil servants who can make the difference in terms of laws or in terms of budgets, are one of the most important audiences. With these type of audiences, like the politicians and civil servants, it's very important that we know how to time the awareness raising, because if there's no policy change being prepared, or even as an idea, it takes an awful lot of energy to get an issue on the agenda. Whereas if there is the context of a policy change already, I mean, for some reason there might be a change in alcohol law, for instance, then that's when you really want to time your messaging and awareness raising. And then the two more audiences that I have listed here, obviously this is not an exhaustive list, but then is the private sector, the employers. For them to understand that alcohol is cutting their prospects for profits. For them to support good regulation and good policies, and also for them to actually take the health of their employees seriously and have the systems in place to help their employees if they have problems. And of course, then the social and healthcare workers, youth workers, and etc. What type of measures they should be taking. So I'm just bringing this because if we don't time the messaging when we are thinking about changes in policies according to the kind of window of opportunity. This is a picture of window of opportunity where you have articulated the problem, you have a solution, a policy, and you have the time when the politics are being made. That's when you can have a change to be made. And I just wanted to highlight this for you. So for policymakers, in addition, this is I'm taking a little bit for granted that the cancer link is part of the messages, but for policymakers, if we want to make a good alcohol policy, again, Carina already actually mentioned all these, except for services for those with problems. And it's something, at least in the Finnish discussion, when we talk about alcohol policies in the parliament, for instance, the discussion very much centers on alcoholism and not on cancer, not on any other chronic disease aspect. Nevertheless, surprisingly, the services for those with alcoholism are not being resourced. So there's kind of double talk. You talk about alcoholism and not about the other health effects of alcohol, but still you don't put any efforts in addressing alcoholism. Then about a little, again, this also Carina raised very similar issues with when we raise awareness among public and individuals about the carcinogenic effect. This I learned, however you say it in English, by a mistake that I made when giving interviews about alcohol and cancer link. The first interviews that I gave, I got especially one phone call that has kind of stuck in my mind. It was a woman with breast cancer who called me and cried and said that now you have stigmatized me. Everybody thinks I'm an alcoholist. I can't even leave my house because everybody will be looking at me and thinking that I'm an alcoholic. So after that, every time when I give an interview about alcohol and cancer, I make sure that in that interview, there is a sentence that says that this is on a popular-based risk, that it's kind of consuming alcohol is like you would choose which lottery you take part of, how many alcohol tickets are in that lottery. And then there is the coincidence and all other factors that for an individual person, we can't say whether it's from alcohol or not, but you can choose which lottery, how big of a risk you are taking. And so I think it's very important to keep that in mind, because people with cancers, active cancers, are struggling a lot with the question of why me? Why did I get this cancer? So I think that we have to be a little bit careful in while bringing it up and helping people not to get cancer, also to bear in mind that those people who have cancer and are suffering from those kind of feelings. So I will end by telling a little bit what we've done in the Cancer Society of Finland. As I said, for policy making or making difference in the over the alcohol policies, it's important to time. And when the alcohol law was renewed in Finland, I actually personally put a lot of effort in that, writing a paper on putting all these issues so that people can refer to it, and then participated in the working group for preparing the law. And then we made statements, expert opinions, lobbied in the parliament, wrote to all members of the parliament in the various important committees who were considering the alcohol law, and also gave a lot of media interviews. Didn't market that, but I mean, a lot of interviews were requested. But now when there's no renewal in foresight for the alcohol law, I'm not doing anything on that level at the moment. Of course, there's lots of research as part of Cancer Register, which is part of the Finnish Cancer Society, and there have been a few information campaigns. A media literacy campaign on alcohol advertisements for young people a few years ago to recognize the social media indirect advertising, and there's been one social media campaign on alcohol use among women, and also a couple of years, consequent years, we had a campaign before 1st of May about alcohol-free drinks. One was a competition on recipes for alcohol-free drinks and so on. So I end with this. Thanks.
Thank you, Eeva, a lot, and the point that you made about stigmatization, extremely important, absolutely. And we who work with alcohol policies, we mainly focus on generalizations and look at the very big picture, and I'm afraid we are too often forget that.
I think you can still make the same kind of arguments, but just be a bit aware of how to frame them so that people don't feel
Thank you.
Unnecessary guilt.
Absolutely. Thank you very much. Now we move on to Iceland, and Dr. Jóhanna Eyrún Torfadóttir is next to speak about the situation in Iceland. The floor is yours. We can't hear you at the moment because your microphone is off.
Sorry.
Yes.
Can you see the slides?
Yes, we can. Please make them full screen. If you.
Yes.
Yes, exactly.
So yes, my name is Jóhanna Torfadóttir, and I come from this small nation from Iceland, where we have 364,000 inhabitants. So we are very few, and when we talk about the incidence of cancer in Iceland, we usually take 5-year period. So now between 2014 and 2018, on average, there are 1,650 people who are diagnosed with cancer. And we have this estimate that 1 in every 3rd Icelander will get cancer sometime during their lifetime. I've been working at the Icelandic Cancer Society since 2018, and it has been many projects that we have been looking at, how to raise awareness about lifestyle in general, and alcohol consumption is one of that link. So just in the beginning, I'm going to tell you about the policy in Iceland on alcohol and drug prevention. So there is this thing that we want to limit access to alcohol and of course other drugs, and you can only buy alcohol in special stores and of course in restaurants and bars, and you have to be 20 years old to be able to buy alcohol, also at restaurants and in bars, and it is quite expensive. I mean, buying alcohol or a glass of white wine in a restaurant, it is quite expensive. And there is also, you are not allowed to drive after you had a drink, and there is a ban on alcohol advertising, although this is a quite hard thing to monitor, and many producers, they also make same drink with less alcohol and they advertise that drink. So it can be really hard to monitor this. And now the parliament is discussing that people could buy alcohol drinks online. So there is a lot of debate going on now in the parliament that is widening the access to alcohol. We have a quite special history with beer in Iceland. In 1989, we were first allowed to buy beer. So, and you can see here, since 1980, there was an average consumption around 4.2 liters of pure alcohol. And in 2007, it was 7.5 liters. And the variety is changing. So before last Christmas, we had 78 different brands of Christmas beers available, and they only have a very small window where you can sell them. I think it's around 2 months a year where they allow Christmas beers to be sold. If we compare it to other countries, Iceland is fairly low in consumption, but Norway is of course lower, and many other countries. We are not sure how much of it comes from tourists. We have had a lot of people visiting Iceland before COVID, so the numbers are maybe not that good to exactly know what the Icelanders are drinking, how much. And but we have sort of some estimates about the frequency of consumption. So if there is the Icelandic Directorate of Health is measuring through a company called Gallup what is the typical consumption. And in 2019, 43% of the Icelanders, they had at least one drink in the last 30 days. And the men are more frequent users than women. The frequency of risk consumption among adults was 24% in 2019, but luckily we have put it a lot. Well, when I was growing up, it was quite common that teenagers were drinking a lot of alcohol, but now the frequency of binge drinking among 10th grade teenagers is 6.5%. And of course, this is too high, but compared to what it used to be, we are at least on the right track. I think this study was mentioned before, where they have calculated that if we would eliminate alcohol consumption in the Nordic countries, we could avoid 83,000 cancers in 30 years. But if we use another scenario, like reducing by 50% of moderate drinkers, in Iceland, we would avoid 55 cancer cases in around 20 years time period. So, of course, if we can avoid even 1 or 2 cases, that is worth mentioning it. But we have to be, of course, careful in not doing the blame game. But we were curious to know if the public knows about the link between alcohol consumption and cancer. And there was a survey done in 2013, so we decided to do again in 2019. And there was a company called Maskina that has available a national sample group of Icelanders that should represent the population in Iceland, 18 years and older, and around 34% of that group completed an online survey. And the main goal was to evaluate the extent of knowledge among the Icelandic public on lifestyle determinants regarding cancer risk in general. So we had a lot of questions, and we asked participants to scale. How strong do you think the link is between this lifestyle factor and cancer? So if they give it 1, it is like there is no link between this and cancer. But if you would give it like 5, there is a strong link between cancer and this type of lifestyle factor. So people are very well aware of the relationship between smoking habits and cancer risk, and they also are very well aware of the genetics. They also about smokeless tobacco, sunburn, and maybe not so much increased AIDS, HPV infections, and e-cigarettes, electronic cigarettes. Although we don't have the link yet, it will take many more years to study this. But it came to a surprise that we saw that there was a much less awareness of the link between alcohol consumption, physical inactivity, high body weight, low consumption of fruit and vegetable, and especially high red meat consumption. This was a surprise to us. And looking at the data from 2013, there is no difference in the awareness among public between alcohol consumption and cancer. So we have focused a lot since then on campaigns and sort of take together the whole lifestyle. And we have these fundraising campaigns in October and March, and we have a lot of people participating, actors that are playing in all kinds of advertisements, and there they are talking about you have to have a good sleep, you have to do some physical activity, drink water, just skip the booze. So this we have been using this a lot, and I think we have many more opportunities. For example, in December, in January, where there's a new year, a new start, and also in the summertime where everybody are grilling the food and you have to have a beer when you're grilling. So we have a lot more of opportunities to raise awareness. And we saw this great idea also from the Cancer Society in Belgium, where they have had this online campaign to educate on lifestyle and cancer risk, where they have this sort of a box. It looks like a food supplement or a medicine, but inside there is only a leaflet with tips on how to reduce the cancer risk. And one of this is to avoid alcohol, or if you use alcohol, drink less. And we are starting this online campaign, and we want to do this online survey again, maybe in a year, to see if there is some increased awareness among the public. But I mean, alcohol is of course associated with having fun, socializing. So this is quite a difficult task. So, I mean, I think this is we have to do this every year and use different approaches. But it is also important to limit the availability, to have strong role models who are telling kids and teenagers, don't drink or wait at least until you are 20 years old to have a beer. Even the president of Iceland has helped a lot in this area. So we just, as a community, we need to help each other, and parents are also role models. So this is an ongoing battle that we have to be aware of and talk about all the time. But I don't think I have so much more to tell you about the Icelandic approach. But if you have any questions, then please ask me or later.
Thank you, Jóhanna. I think we will leave the option is there definitely, and we will come back to a couple of questions at least in the end part. Thank you so much. And again, the Icelandic situation kind of raises the question, why is it so difficult that this message gets through, that we don't see a big change, although the work is being done and the materials are out there, the word is out there, but the knowledge doesn't seem to grow very much. So thank you again. Thank you. And now we turn to Denmark. Anne-Sophie Plum Christensen from the Danish Cancer Society. Please.
Thank you. And now I can't see the share. Yeah, it is.
Down there? Yeah.
It's there. Thank you.
Choose the program, yes, and put it up on full screen as well. Yeah. Very
great. Good. Well, thank you for the invitation to speak today. And my name is Anne-Sophie, and I'm from the Danish Cancer Society. And I would like to talk about how we try to increase awareness about the link between alcohol and cancer. And first, a little bit about the background. As you all know, alcohol increases the risk of cancer. And it's estimated that alcohol is responsible for 5% of all cancers in Denmark. And it's also estimated that more than 32,000 cancer cases could be avoided in a 30-year period in Denmark if alcohol was entirely eliminated in Denmark. We also know that more than 800,000 Danes drink more than our low-risk guidelines, and that corresponds to 1 in 5 adult Danes drinking too much alcohol. And we know that we have a very low awareness of the link between alcohol and cancer in the Danish population. So we decided to make some campaigns about this association between alcohol and cancer. And since 2017, we have had 3 campaigns, and a 4th is on its way. And we have done so because we believe that the Danish population have a right to know about this link in order to take an informed choice about alcohol consumption. And the first campaign was called Alcohol Does Something to Us. And it was the first time that we, together with the Danish foundation Trygfonden, was launching an awareness campaign about alcohol and cancer. And it consisted of 5 small campaign movies about showing 5 types that you can become when you get too much alcohol. And I will show you 2 of these movies on the next slides. Then in 2018, we were relaunching this campaign, but turning these 5 different movies into one, and where we had a more explicit focus on the low-risk drinking guidelines in Denmark, because we learned that people want to know how much they can drink without increasing their risk of cancer too much. And then the year after, we ran this campaign called Cut the Insignificant Units, where we didn't have an explicit focus on alcohol and cancer, but we were trying to make people aware about how much alcohol they drank, and also if some units were more important for them than others, so that they could cut those units that were insignificant to them. And next month we are running a campaign again with the same focus on the insignificant units. And even though the focus was not directly on alcohol and cancer in this campaign movie from last year, we had a lot of content on social media about alcohol and cancer as well, and also in the news media. Yes, I'll show you 2 movies. I hope it works.
Alkohol gør noget ved os. I et splitsekund forsvinder vi fra virkeligheden. Vi skal bare lige hvile øjenlågene et øjeblik. Vi svæver i vores egen verden, og sjældent har en klapstol fra køkkenet været så behagelig. Med et grønt spærrer vi øjnene op igen. Hvor er vi? Der er bare grin med. Det er der ingen, der lægger mærke til.
Uanset hvad alkohol gør ved dig, så er der én ting, vi alle har til fælles. Og det er, at alkohol kan give os kræft. Så drik mindre og nedsæt risikoen for 7 forskellige kræftformer. Se mere på alkohol-og-kræft.dk.
Yes. And then one other character from this campaign.
Alkohol gør noget ved os. Pludselig kommer alle følelser væltende ud på samme tid. Vi kan ikke rigtig forklare, hvordan det startede, eller hvorfor vi nu griner. Men én ting er sikkert. Alle omkring os er vores bedste venner og skal vide, hvor meget vi elsker dem. Også selvom vi kun lige har mødt dem.
Uanset hvad alkohol gør ved dig, så er der én ting, vi alle har til fælles. Og det er, at alkohol kan give os kræft. Så drik mindre og nedsæt risikoen for 7 forskellige kræftformer. Se mere på alkohol-og-kræft.dk.
Yes. So we chose this approach because it was important for us to take the Danish alcohol culture into account. We drink quite a lot of alcohol, and very few people do not drink alcohol at all. So yeah, and we also injected a note of humor and warmth into the campaign films. as well as a bit of sadness, you can say. And then we used our qualitative insights about how most Danes behave when they get a little too much to drink. Of course, we gave the characters a bit of an edge, but we think that most Danes are able to relate or to recognize these different characters. And yeah, all these characters have this one thing in common, that alcohol increases the risk of cancer. And our voiceover uses the term we because we do not want to raise a warning finger to the Danish population. It's about all of us. And the campaign platform was primarily Facebook, our Danish Cancer Society's Facebook and Instagram, and our YouTube channel. And we had a social media team answering critical comments and questions on social media. And it was actually necessary to be full-time working on this during the campaign period. We also had this website, Alkohol og Kræft DK, with supporting information about alcohol and cancer. And after each of our campaigns, we have evaluated the campaigns and also measured if awareness has decreased or increased. And this slide might be a bit confusing, but I will talk you through it. Before our first campaign in 2017, we had an unprompted awareness of alcohol as a carcinogen. It was 22%. And by unprompted awareness, we have asked which diseases do you think alcohol increases the risk of? Please state all diseases that come into your mind, and with an open-ended question, so people have to write cancer or similar if they believe so. And prompted awareness was measured by asking which of the following diseases do you think alcohol increases the risk of, and then with a list of 7 different options, including cancer. So yes, unprompted awareness was 22%, and prompted awareness was 45% before the first campaign. And then after the campaign, awareness was increasing for both measures to 27% and 50%. So we were quite happy about that. However, after the relaunch of the campaign the year after, we actually found less awareness. It was 19% unprompted, and prompted it was 45%. However, we used another analysis firm this year compared to the other years. And also we had to introduce a GDPR text, which also affected the unprompted awareness because the question was a bit different. However, the next year we went back to the same analysis firm as the 2 first years. It's not the same respondents that we have asked, but it's the same firm. And then the unprompted awareness was the same level as our baseline survey, and prompted awareness was higher than ever before. So we hope to see a more clear picture when we evaluate our next campaign, and to hopefully see an increase in awareness. Again, cut the insignificant units did not have this explicit focus on alcohol and cancer, as alcohol does something to us head. So that might be part of the explanation. We have also done some research showing that after the first campaign, awareness was higher than prior to it, and also that support for most alcohol-related policies was higher following the campaign. And what have we learned after this? It's not an easy task to increase awareness. And it's important to continue to communicate that alcohol increases the risk of cancer. We also found that 9 out of 10 think the campaign is relevant, but only 4 out of 10 think it's relevant to them. And we think that this might be because people link alcohol with a very high consumption. So if you don't drink that much, you might think, oh, it's not about me. And also awareness about specific cancer types, including breast cancer, is very low. It's primarily liver cancer that people in our survey link with cancer. Also, Danes actually want to know that alcohol is carcinogenic. And they also want to know how much alcohol they can drink in order to keep their risk of cancer low. Well, thank you.
Thank you, Sofie. Thank you very much. And I can say that actually your campaigns and materials were one of the motivations why we started the alcohol awareness blog, and we have collected now more than 1,600 campaigns from all over the world, and as I mentioned, over 130 regarding alcohol and cancer. So you're doing an excellent job, and thanks for sharing it.
Thank you.
Yeah. Now we turn to Per Leimar from IOGT-NTO. So from cancer societies now to an NGO which is leading the work in Sweden. Per, it is your time.
Thank you. Yes, as Lauri said, Per Leimar from Swedish largest temperance organization, IOGT-NTO. I work at the office in the national office in Stockholm. And I'm not from a cancer society then. You may perhaps say that I work as an analyst in alcohol in the borderland between policy and research. So I will try to say some things about why possibly the link between alcohol and cancer is not very well known in Sweden. And one of the, if I can change my little screen. Well, okay. And one of the starting points for Sweden in this is this survey from Europe, it's now 10 years old, from 2010. And I don't know if you can find Sweden. I will help you. You pass all other countries and you end in the bottom. According to this research then, 10 years ago, Sweden is the worst country in Europe. All of your countries and every other countries are better than Sweden in knowing the link between alcohol and cancer. So is this still the case? Well, I don't know. I think the awareness has been growing a bit. I don't know of any new Swedish surveys, but there might be some. But I was thinking of talking about why I think this link is so little known in Sweden. And I was almost saying, as usual, I have no idea what I'm talking about, but you will see what I will say. And I was thinking, it strikes me now that maybe this is not very relevant to you not living in Sweden, to see why Sweden is like this. Apart from feeling proud of the country you live in and happy to not live in Sweden. But we'll see. So to illustrate why I looked at some web pages that sort of has information on cancer in Sweden, where I would guess you would go to look for information like this. And my first choice is, of course, the Public Health Agency of Sweden. And if you look at their webpage, you can't really find anything easy on cancer. You have to sort of use their search engine, search for cancer, and then you get to a page where they talk about folk diseases, folksjukdomar, sort of common diseases in Sweden, and cancer is one of them. And on that page, they list the risk factors for cancer, and they are smoking, diet, and low physical activity. I don't know if you see something missing here, but okay. I suppose few people would go to the Public Health Agency of Sweden's website to look for information on cancer. So, and they have a webpage on information on harm from alcohol, and there cancer is mentioned. But then you would need to look for information on alcohol. And if you don't know that alcohol causes cancer, you wouldn't look there. So you could look at the National Board of Health and Welfare, Socialstyrelsen. They are directed at people working, staff in the healthcare, but they have pages for information for patients, especially on lifestyle. So if you look there on their lifestyle information for patients, they mention cancer and they mention different lifestyles that could influence the risk. And what they say there is maybe you drink too much. Maybe that's a problem with lifestyle and disease. And it is not clear at all that there is a link between alcohol and cancer. They have a publication which is called Cancer in Numbers 2018, where the facts are mentioned, but you really have to dig deep to find that. So, but I think most people would go to our information site, which is called 1177, which has information about diseases and where you can get find healthcare and so on. And they have a page on what can you do to reduce cancer risk, where they list well, different risk factors. And there alcohol is mentioned as second. And what it says there, what can you do to reduce cancer risk? You can drink moderately. Okay. Is that the correct advice? Well, but it does go on, or no alcohol. But still, if you read this, I would suspect that you think, I mean, it does actually say that if I drink moderately, I reduce my cancer risk. And perhaps I could drink no alcohol at all, but I mean, if I have to choose, how would I like to reduce my cancer risk? Well, maybe I would like to do that by drinking alcohol moderately. And then I looked at another site, which is the Regional Cancer Centers site. The Regional Cancer Centers are the specialists on cancer in Sweden, have centers all over Sweden. And luckily enough, there you do find information on alcohol and cancer with the message of there is no safe level, and the European cancer code is on there and so on. And it actually says then the risk for breast cancer increases already at 1 glass a day. So that's okay. But at the same time, it says the big increase in risk you get at relatively heavy consumption. So if you're looking for this kind of information, and this is directed at healthcare sector, you still would say that the impression is that there is no really serious risk. You only will have a serious risk when you drink heavily. I would say that's the impression. So then we get to the star so far of this presentation, the Swedish Cancer Society, Cancerfonden. They have quite a lot of information on alcohol and cancer on their website, and they have sort of tick the right boxes. Moderate drinking, increased risk. There is no risk-free consumption, but then they have this message as well as the regional cancer centers, the big increase in risk you get at relatively heavy consumption. And is that true? Well, of course, the risk is greater if you drink more. But to me, this statement does not reflect what we know. The risk increase is linear or log linear, so there's no sort of level at which you suddenly get a greater risk. It's continuous. And then there is information on risky consumption. And why is that there? If you have this as a reader, I would suppose that I would say, okay, they have this information about risky consumption, which is only 16% of the population. That must be the risk. Because if you don't drink with a risky consumption, there is no risk. I mean, that's the meaning of the word. And it's only 16% of the consumption that has this risky consumption. So that cannot be me. But still, the Cancer Society has what should you do? They have the policies that they want to promote, and that's great. That's really good. And it's these, we need to inform about this. We need to have warning labels and so on. We need to raise alcohol tax. And I've heard from people working at the Cancerfonden that they are going to work more on information about campaigning about alcohol's role for cancer, and that they are especially inspired by the Danish Cancer Society, which I think is great because you're doing a fantastic job. And then I just now added the biggest star on the screen, which I hadn't thought about until I saw that Anna Ranninen was among the participants today, who works at Systembolaget. So I looked at Systembolaget's site, and there you have all the correct. You tick all the boxes. It's in every sense correct. The more you drink, the higher the risk. Moderate drinking increases. Alcohol is the second largest risk factor. No one else has said that from any of the Swedish agencies or the Cancer Society. And the Systembolaget even have the sort of suspected cancer varieties listed. And there is no risk-free level. But still, I mean, it's fantastic that Systembolaget do this information. But if you're interested in cancer, if you don't know that alcohol causes cancer, you won't go to Systembolaget's website to look for it. Okay, I think I'll just mention that the cancer centers have a fantastic calculator where regions in Sweden can calculate what would happen if we reduce risks, and you can see that in incidents, the dailies, costs to healthcare, and it's a great web tool which I think is used quite a lot. And here is sort of the list of ranking of the risk factors. You see smoking is highest, low physical activity, high BMI, and then alcohol has the least impact. And if you look at this, if you're work in the region as a decision maker or within the healthcare sector, what would you prioritize? Well, smoking, yes. Low physical activity, yes. Would you do anything about alcohol? Probably not. But the interesting thing is, if you compare this to the global burden of disease estimate, the ranking order is quite different. Smoking is number one, that was the same. alcohol is number 2 in global burden of disease. It was the lowest in the cancer centers. So again, I think this, you may argue, is the reason why people in Sweden, not even the experts, not even the healthcare sector, really thinks that alcohol is a serious issue when it comes to cancer. I may be wrong, but that's my impression. So if you look at the global burden of disease, the new estimate that came a week ago or so, you see, as we've already said, alcohol is the second largest risk factor for cancer in Sweden, as was stated at Systembolagets website. But the awareness of this seems to be almost non-existent in Sweden. I never hear it. And if you look at breast cancers in Sweden, for instance, you see that alcohol is clearly the most, the number 1 risk factor. And that I've never heard anyone say in Sweden. But okay, I just wanted to mention that a couple of years back, there was a report on alcohol and cancer, which a couple of organizations, among them the Stiftelsen Ansvar för Framtiden, who contributed financially to it. So then, and with the hope that this would somehow contribute to raise the awareness of alcohol's role for cancer in Sweden. I'll pass that one, but here you see how almost a third of cancers is estimated in Sweden to come from low risk consumption below the guidelines, which we heard from Canada, Lauri talked about. Then last year there was a similar report on alcohol and pregnancy, and you might say that this has nothing to do with cancer, but there are possible links even here between alcohol and childhood leukemia. It's not accepted by, hasn't sort of reached the status of being confirmed by the WHO, for instance. But there are studies that say that fetal alcohol exposure, these are quotes from the report, could have a link. And large meta-analysis show that there's a link between alcohol consumption during pregnancy of the mother to AML, and there are even studies saying that paternal consumption 12 months before conception increases the risk of ALL, the largest leukemia variety. So if you want to find these reports and read them, they are available in English as PDF on our website. Otherwise, they are in Swedish. I don't know, do I have time to continue, Lauri, or should I stop there?
If you could wrap it up in a couple of minutes, then it's...
A couple of minutes. I just run you through, maybe you can have these slides or get these. I just wanted to show a couple of articles that you probably know of already. It's a comment in Addiction from Tim Stockwell and Jinhui Zhao on why alcohol's contribution to cancer is underestimated. And it's underestimated, says Stockwell and Zhao, for the exactly same reason that its cardioprotection is overestimated, because of the flaws and the bias in the studies that underlie these calculations of estimations of the relative risks. So when they did a meta-analysis of alcohol and prostate cancer and took away the studies that have clearly one of these biases, the risk from prostate cancer for alcohol tripled from 8% to 23%. So that's one reason why you should take alcohol more seriously than you do. And last thing, you have perhaps seen the very interesting studies on putting warning labels on alcohol in Canada, which was stopped by the alcohol industry, but these are the labels, and the alcohol industry lobbied heavily and threatened the government in the province where this was made to take them into court, and the government couldn't afford that, so they stopped the campaign. But the effects they had were still going on enough to measure the effects. And one of the things that happened was actually that people did drink less because of these warning labels. So this is a bunch of interesting studies coming out from that. So, well, what should you do? Well, apart from all these policies, it strikes me when I go through this in Sweden, you should talk to the specialists to see if they would sort of inform more clearly about this connection. So thank you. Sorry if I went over a bit.
No problem. Thank you, Per. I think that kind of critical analysis, all our countries, it would be good to have that kind of deeper look, especially on the state agencies' websites and so on. So excellent. Thank you very much. We are over the time a little bit, but I hope some of you at least can stick around for a few more minutes. Nils, please take it over and let's see for a couple of questions.
Yes, there has been a couple of questions. I will start with two. The first question is from Women's Organizations Committee on Alcohol and Drug Issues, and that's a question, I guess, based on the finding on the risk for breast cancer. So if there should be more information specifically for women about hormones or the risk in general. So if any one of you would like to pick that up and comment. And then there is also a question from Nadia Fredriksson, who says it seems like there's a lot of good work being done in the Nordic countries and the cancer societies, but how do we collaborate more across the Nordic countries on the topic so we can lift it to health authorities? So what other steps could be done in this context? So let's start with those two, I think.
Anyone want to respond to these questions? Remember to unmute.
Well, I could, on the issue of women and breast cancer, of course, you need to do much more. So, but the question is how, and I think you really need to get the healthcare sector and the cancer care and on board. And if we don't do that, it will be hard. But it's, to me, that's obvious. Yes, we should do much more.
Yes, and I agree with that. Actually, we had a focus on alcohol and breast cancer in our first campaign, but it didn't really change awareness. And I think we decided to start to increase awareness of cancers in general, but I think it's important along the way to inform that it's also about cancer types that you don't really associate with alcohol.
I don't know, I might add just on a personal note, I was invited a couple of years back to give a presentation on alcohol and breast cancer for a breast cancer patient organization. So there were 50 women who had breast cancer in the room, and I was really very nervous to give that kind of presentation. I mean, how would they respond and react? But to my surprise, I wasn't beaten and thrown out of the room. They said that they thought this was very interesting, And they asked, why haven't anyone said this before? So yes, more information is needed, and I don't think it isn't as unwelcome as you might think sometimes.
Anyone else? Or maybe Nils, you can move on with other questions.
Yeah, it brings a bit, it was another question here, it brings a bit of on exactly this topic, because like you, Carina, and also from Finland said, when it comes to the public and the individual health or the personal health advice. And then maybe you could explain a little bit more what is more sensitive when it comes to alcohol, for example, compared to sunbeds, when it comes to the advice. And how do we then communicate? For one thing is talking about public health approach or public policies in general, but at the same time, I guess there is also a wish to communicate directly to individuals about these issues. So how to strike the right balance on these things?
I can try something, because you know the industry is very interested in keeping it on an individual level and give the individual itself the responsibility for drink properly and the responsible. But there is a reason the WHO's best buys are best buys. They are tackling the whole populations, and we know what's works best when it comes to reduce consumption. So I think we need to stay on that track. It is the population level we should address our information to. That's my point of view.
Well, I think that breast cancer is an extremely good example of the dilemmas between population health and individual health. Because when you think about breast cancer, 60% of the alcohol-linked cancers in women are breast cancers. But then when you look at individual person, 5% of the risk is alcohol. So I mean, it is an enormous risk, but it's still 5%. So I think I've actually succeeded in the media interviews. Campaign is a different issue, but because I have not personally done a campaign on breast cancer, but I've done quite many interviews discussing breast cancer and alcohol. So I think it is, like I said before, it's extremely important to make it explicit what it means that you, on your population base, increase the risk, so that you have to discuss the population and individual. And what I've done, like I told you in the presentation, I've basically used the lottery example, and I think people understand that. But it is, I think when you discuss with politicians and decision makers, they need to, especially they need to understand the population-based issues, and there you don't have the kind of dilemma of the individual risk and the population risk. You can much more straightforwardly discuss the population risk.
Have you heard about Stephanie Menzimer in the United States? She's an American journalist for Mother Jones. She got her breast cancer 47 years old without any apparent risk factors. She started to dig into this and found out that the only risk factor that might have contributed was that she was binge drinking in college. And she got furious and started to dig into all these aspects of the care she had received, and she said that nobody had ever told her about alcohol, not before she got cancer, and not during her treatment, and not after her treatment. She has written a lot of great articles in Mother Jones. You can just Google Stephanie Menswear. I checked yesterday if she was still alive, and she is. She did a great job. And also it's great to hear, Per, that you had good experience in that breast cancer patient group. So it is sensitive and it's difficult, but we have to continue to work.
Yes, the work has to be continued, and I know that all the organizations that were in our panel today, you are doing this this work with very big dedication, and our small project, which hopes to give our part into this cooperation and networking. As I mentioned, the website that is being done at this moment. Later in the first part of next year, probably in March, we are hoping to have a physical meeting as well, a sort of a roundtable or a symposium. So we will approach all of you with invitations, but we will see, of course, what's the situation outside and how the pandemic situation evolves. So I thank you all very much, all the panelists, all the participants. Thank you for the time. Thank you for the work that you are doing. Alcohol and cancer topic is a growing topic and is being focused in the European Union. We know that the EU, Europe's Beating Cancer Plan will be published soon, and alcohol has its place there. We have heard that. Eurocare is doing an alcohol awareness week. Nils, what are the dates exactly in November at some point?
Yes, it's Monday 16, isn't that Monday of November? That week is the European Alcohol Awareness Week, and the topic of this year is cancer, alcohol and cancer. So as well there, we will be 2 webinars, so we can explore the issue further, and also 1 webinar dedicated to COVID-19 and alcohol and during that week. So please stay tuned into that.
Yes, thank you very much. And this webinar was recorded, so you will find the recorded video later on our website, NordAN.org, and we will share it via Facebook as well, and so on. So thank you all. Thank you for being here, and have a great day. Bye.